Okay, let's go to Grover Norquist now. He is, of course, from Americans for Tax Reform. He is the president of that organization. Grover, $321 billion is a lot of money. As I remember, that's about twice as much, or perhaps even a little more so, than what the House bill was said to save over a 10-year period. So both in terms of the number of Americans uninsured, 24 million in the House bill, and in terms of the dollars saved, less than 200 billion in the House bill. This is doing a lot better from the CBO accounting, correct?
It is, but the Senate bill and the House bill both get rid of all of the tax increases in Obamacare. The Senate does it in a phased-in period as opposed to all at once, and it takes a slightly different approach on allowing states to opt out of certain mandates, which will save taxpayers and consumers of health care a great deal of money. Those numbers about how many people will lose their health care, since they count people who are forced to buy health care with penalties, and they're no longer forced to, that's like referring to people being kicked out of East Germany when the wall came down. People asking to leave Obamacare are not denied health care. They are not required to buy the straitjacket that Obamacare was. Add to that, the CBO was off by a factor of 2 on how many people were going to go into Obamacare.
Right.
So I don't care what their estimates, I mean, I don't believe as accurate their estimates on how many people in and out. What we do know is that the law says they have to confirm that this will not increase the deficit.
Now, a couple of things, Grover. The key here is that while both of us have problems with CBO estimates with regard to this, they don't differentiate between whether people are forced to or not. A lot of senators are kind of hinging their vote on how the CBO came down and how they scored this bill. Is this likely to put any people that had reservations about it on the plus side?
Well, I think that you've got 4 people, maybe 5 people looking at it. Maybe there should be 3 of those 5 that will come back and vote for this bill. There may yet be a change or 2 that comes in. We should be at the 50 we need. They may take
really?
turns.
So you think it'll pass this week?
I do, because when you take a look at it, Ted Cruz and Lee and Johnson are all serious, grown-up Reagan Republicans who understand that this is step 1 in reforming health care. There's much more to be done. You can't do it all inside reconciliation, and a lot of it will be done through executive orders, because the original Obamacare was set up to be run by a little dictator over at HHS.